Okay, so we'll adjust the camera. Good morning. Welcome to Arlington Economic Development's webinar series on Reopen Safely. Thank you for joining us. My name is Cindy Ye, and I will be your host and moderator for today's session. Some housekeeping rules. This session is being recorded, and you heard that every participant, everyone joining is on mute. If for some reason you're accidentally logged off, please just log back in and rejoin the session. On the right-hand side of your screen, you will see tabs, the question tab. So if you have any questions or comments, please submit it through the question tab, and our staff behind the scenes will route it to me, and I will pose it to our panelists. And we'll also be conducting 2 short surveys throughout the webinar, one of which I believe you may have already responded. Thank you for responding, since that helped guide us throughout the hour. Next slide, please. Then here's the agenda for this hour. I'm very happy to introduce Telly Tucker, Director of Arlington Economic Development. Telly will kick off the hour. Just some interesting tidbits about Telly. He joined us in early January, and little did he know he will be asked to lead the department's response to the pandemic, and with his entire staff working from home since March 13th. So Telly, welcome.
Thank you, Cindy. Good morning, everyone. As Cindy said, I'm Telly Tucker. I'm the Director of Economic Development for Arlington County. Over the past few months, the AED staff has had a considerable amount of engagements with our business community through surveys, through one-on-one consultations with small businesses, and through some roundtable discussions with some of Arlington's larger businesses. Through all of that interaction, we really learned that there was interest in hearing specifically about Arlington, hearing from Arlington's public health officials. And so we're delighted that Dr. Reuben Varghese is on the panel today. This is directly in response to what we heard from some of our business community. This series is a series hosted by AED, helping guide businesses in their return to work. Our Small Business Center News Launch team, many of you know Tara Palacios and her team, they have hosted a webinar last month targeting retail and restaurant businesses. Today's webinar is geared more towards office tenants. And so the intention for the webinar is to serve as a guide and a resource for you, businesses, as you evaluate your plans to return to work safely. So thank you for the opportunity. Once again, welcome on behalf of AED, and I'll turn it back over to Cindy to introduce our panelists.
Okay, next slide, please. Then we will have the 3 panelists for today. They will introduce themselves and their company. We will start with Lisa McGregor of Jacobs. Lisa.
Thank you, Cindy. Good morning, everyone. Thank you for joining us today. I'm Lisa McGregor, Jacobs Global Lead for Workplace Space Strategies, and I develop space strategies that align organizational goals, new ways of working, and real estate needs.
Okay, and Emily Neff of CBRE.
Thank you, Cindy. Good morning, everyone. I'm Emily Neff. I'm a director with CBRE's Workplace and Space Enablement team. CBRE is the largest commercial real estate organization globally, and for the last 3 or 4 months, we've been focused pretty much entirely on how we can realign workplaces in a post-COVID environment. So we're excited to talk to you today.
Okay. And also my colleague from Arlington County's Department of Public Health, Dr. Reuben Varghese. We can't see Reuben's screen right now, but we can see his headshot with his mask on. So we wonder, Reuben, can you hear us?
I can hear you. Can you hear me?
It's very faint. Reuben, can everybody hear him?
Hear me now?
No?
You still can't hear me. Okay, let me see if I can. Let me just. Can you hear me now?
Yes.
Okay.
Okay. Ruben, we can hear
It
you.
says that my webcam is on, but it's not, obviously. So apparently I took my background photo literally seriously, and so I'm hiding behind a mask. So my apologies. So I've clicked on it multiple times, and it's not letting me portray myself. I must have bad hair. So I am Arlington's public health director, and been leading the efforts on COVID for the county for the public health response since at least January. So happy to discuss with you our efforts and how we can help you be more successful in however you are conducting your business, wherever you are.
Okay, thank you. We'll just follow up with Reuben then with your conversations. We'll start with the health status. Most of the attendees on this call lives in the Washington, D.C. area, but I know some are from like Philadelphia, Atlanta, and in Boston. I think the Washington area is one of the few areas in the country where COVID cases remain steady for the prior 2 weeks. And Virginia has entered phase 3. So Reuben, can you comment on what is the current health environment in Northern Virginia?
Sure, it's a great question. I'm going to go globally first, okay? And I'm using my hands, which you can't see. There you go. So we need to remember we have a global pandemic. Pandemic just means on multiple continents, we've got an outbreak of COVID, and that has not changed. And it's true in the United States. So even though in the National Capital Region, which we define as the 2 suburban Maryland counties around DC, the District of Columbia, and the 5 major jurisdictions in Northern Virginia and their smaller communities, that's the National Capital Region, and through the Council of Governments and so on. We have a pandemic here. The conditions have improved, the numbers have improved, but we still have community-wide transmission. And as people know throughout the nation, we're at different phases of the same community-wide transmission and spread in the US. And we're not in, people may hear about pandemic waves. We're still in the first wave of this pandemic. So the spikes you may be seeing elsewhere, not a second phase. It's the first phase not going so well, okay? From a public health perspective, the more we stay at home and not interact, we have a better chance of preventing the spread of virus. As we reopen up, that's why when the governor is doing it solely in Virginia, we're looking to see, are there spikes? You've seen in other places where they've gone, imagine me opening a faucet, turning on a faucet slowly for a trickle or opening up to a flood. Some places did it as a flood versus a trickle. There's going to be a risk here whenever we reopen, and so that's not a public health decision. I want to make sure people are very clear. It was not public health that recommended. If I had my druthers, I would not reopen. That's because I'm maximizing life safety, okay? I'm glad other people are in charge of the world than me. They make other decisions because we've got to have a balance. But from that perspective, it's why we have to make it very clear that the germ is present, and this webinar and the things you've been doing is going to be very critical to prevent more spread in your workplaces should you bring people together, because your talent is your bread and butter. They are what make you resilient, and so you want your workforce to be healthy, to be able to actually have a business. So I'm going to leave it there, Cindy.
Yeah, and this is exactly what the webinar is about. We want this to be a guide and resource for people listening if they're considering transitioning back to the office. Also, Reuben, what are the county's main priorities? Is it for testing, or what are the priorities?
Well, the priority, plain and simple, is to convince people to stay put as much as possible and not interact unless it's essential, okay? That is the public health priority, okay? Because we want germ transmission to stop, because the sooner that happens, it's better for everyone, including the businesses. With reopening, we want those same things to occur. if at all possible, if your business can permit staying at home, please do. We know that's not possible for all businesses. So we leave it up to businesses to decide what's essential. But I did point out, your employees are your #1 asset. And if they're not healthy, you're not going to have a healthy business. And obviously, you don't want your customers to get anything from your employees and vice versa, because that's not a good message to send to the public that come here, you can get infected from us, okay? So in that context, the priorities then are trying to encourage people to do those right things, including individuals and the businesses. And then we're trying to facilitate having more testing available, but it's easier when the states do it because they have bigger buying power. It doesn't mean we haven't been trying. We're trying to pursue saliva-based testing, because if saliva-based testing is available, that's a game changer, because you don't have to do the more invasive nasopharyngeal swabs that go really up your nose and require a lot sort of PPE. So we're trying to do some of those things to make that maybe more readily available for people, so that in targeted areas, testing would be more simple. Information is important, getting that out to people about this sort of stuff. We're doing contact tracing and case investigations so we can try to contain things. And we're providing wraparound services for those individuals who need to be in isolation or quarantine, who can't otherwise afford it, so they can at least stay put for 14 days so that they can get better and or not spread the virus to other people. So we're trying to do exactly what we're saying, and we need your help as businesses and as just residents of the area, wherever you are, to do these things, because it's going to take a village for us to prevent the spread and one day get out of this, because I'm hoping there's a vaccine coming. But until that day happens, we really need to do this together.
Okay, thank you. Lisa, my next question will be for you. Jacobs has 53,000 employees worldwide. What is Jacobs telling employees to do?
Well, Dr. Varghese will enjoy hearing this. We're being very cautious. And again, our culture of caring leads us to really be focused on our not only our employee health and wellness, but that of their families as well, and the communities. We really are strong as a corporation, feel that we're partnerships in any community with which we have an office. So not only are we taking that approach on our own to a very cautious reentry, what we're doing to work with our global customers is similar. We're seeing this as an opportunity. Everyone's forced into this remote work adoption that we've been really doing for a long time. And we know we can work effectively this way. So that's where, as a workplace strategist, we're working with organizations to help them align how they can meet their business goals. Again, one, by keeping their talent healthy. And then also, equally important is, how do they encourage and really support the culture of their people while they're remote in these distributed work models. So that can be new for organizations, and we're working with them in that. For initial reentry, we are recommending prioritizing essential site functions, and some of our clientele in critical mission and in much of advanced facility type work, that is essential right now. And a lot of the biotech and pharma companies that we work with, we want certain people to go in and help solve this problem. So again, adopting new work models, really identifying and think differently how you can work with, rethinking how your teams are organized.
Okay, I think Lisa, can you all hear Lisa? You can still hear her? Okay, I think Lisa.
No,
okay, Lisa, your screen just froze. So we'll go to Emily then. Emily, I'll pose similar questions. What is CBRE telling employees to do? We'll wait for Lisa when she joins.
Sure. Well, I think the good news is that it flows quite well in that CBRE is very similar to Jacob's right now. We are prioritizing at the very, very foremost the health of our own people and their families and our clients who we're interacting with. And it's been interesting to see how the wave of information from March to April to now it's July 9th has changed our approach, which I'm happy to be part of an organization that is allowing themselves to be very fluid and be very flexible. What started with a green gold team rotational shift has very quickly shifted to a more deep focus on what it truly means to be an essential to return to the office worker. We've changed our perspective on that, and we've refocused on how those who are going to be staying remote for longer have the tools and the support that they need, whether it's technology training, whether it's HR benefits around financial aid or around ergonomic at-home setup or around managing your work while you're taking care of children. So we really have pivoted to recognize that this is not so much about the date with which we feel we can re-enter at 30% occupancy or 50% occupancy. It's about taking a position that we're going to be managing this for the long term, or at least until there is a therapeutic or a vaccine, as Dr. Varghese mentioned. Some of the more tactical things, which I know we'll talk more about, we do have signage up and ready. We do have social distancing plans that allow people to understand how much proximity is appropriate in conference rooms and at workstations. So those more tactical things are in place, but our priority has really shifted to better understanding what makes someone essential to return.
Okay, good. Lisa, I'm glad you're back.
I'm sorry, I'm not sure what happened.
Yeah, you got dark shortly. Now you're back. To pick up from what you've said about what Jacobs is doing, your role with Jacobs provides a global perspective on workplace solutions. Will you share some of the innovative practices that's been implemented worldwide in response to the pandemic for your clients or for your organization?
Well, again, our approach is no different than it was previously from a workplace strategy standpoint. We encourage people to look at activities and prioritize which of those activities are site essential, which are better in person, which right now is not necessarily possible, and what can be done remotely. And then again, what are the tools needed to support that? I think this rapid adoption has forced companies to accelerate programs to expand many of the technology platforms and tools that they use to host different types of collaborative sessions. We are a firm believer that there's a great benefit to being in person to build culture and community and organizational identity. But right now, again, as Emily said, this is a little bit of a distance out. So people should start looking at how can we think differently and how can we establish virtual placemaking as well as physical placemaking. Our role as really designers and architects and engineers sometimes focuses on the physical, but really from a workplace strategy standpoint, we're looking at distributed work models that encompass both virtual and physical placemaking and platforms for people to work together.
And Emily, you work with the tenant side at CBRE. What are you hearing from businesses as they consider right now bringing employees back?
Sure. So I would break this out into three primary areas of focus. I think first is what Lisa and I have been sharing. It's understanding the demand for space. It's understanding who needs to return and more importantly, maybe why. If we've talked about this in a number of discussions that we've all had together. If the why for returning is because I need to collaborate face to face, let's make sure people understand that when they go back in the near term, face to face is mask to mask, and it's 3 people in what was a 10-person conference room, and it's remembering that there's going to be virtual participants over Zoom or GoToMeeting or Teams, and so it's a little bit of a different, or a lot of bit of a different collaborative environment than what we left behind when we left in March. We're big advocates of surveying people, so we're telling all of the tenants we work with to engage people in this dialogue, let them react to the positives, but also the challenges they've experienced with remote working. One interesting point that might come as a surprise to those listening is millennials actually are voicing some of the biggest struggles at home right now. And whether that's because they're sharing apartments with roommates or because they have very small children at home, there's a number of reasons why that may be. But those who historically were some of the drivers for we want to work more flexibly are now challenged in this you must work only flexibly model. So it's really interesting to get the employee perspective. The second and the third point are pretty quick, and that's tenants understanding their operational readiness and their facility readiness. You know, do they have policies in place for actually enforcing any of the new procedures that they're laying out? So we've all been to the grocery store the last few months. We've seen the directional arrows. We've seen people follow and not follow those arrows. And so I think the policies that companies are planning for in some instances are only going to be as strong as having someone who's available to enforce them, to make sure people are the safest that they can be, knowing that there's no 100% safe office available. And then lastly, on that facility side, people will want to see visibly and will want to hear from leaders the changes that have taken effect, whether it's around indoor air quality, whether it's around enhanced nightly cleaning. So I think having a plan to not only improve the facility conditions, but to be transparent and communicating to people what those changes are will be very valuable.
Okay, we just had a question coming in. Any recommendations for holding productive group meetings or brainstorming sessions with the mask on? As we're talking about, if in a conference room, people will be wearing masks and speaking, and some will be on screen. So any recommendations for creative ways to hold meetings like that?
Well, again, this is where technology and embracing new platforms will come into play. And again, this takes, it's not just purchasing the software for your company, it's providing the training and really enabling people and empowering people to work differently. Certainly, what we get out of in-person workshops is really valuable. Strategists, I'm sure Emily would agree. But right now, what we need to think about is how we can have these same type of sessions with whiteboards, virtual whiteboards, and those tools do exist in a number of software platforms, one of which we use is called Mural, but I'm sure there are many others that allow that same sort of open flow of dialogue, different color post-its for different participants, that same sort of what you think is very free form needs to have a little bit more of a structure and a cadence and a mindful planning to it, but still can be done.
Mm-hmm. Are your clients embracing these type of new platforms? Are you seeing how is it working out for them?
Well, again, everything takes a little bit of training, as when we all got on this call, every time we get on a different type of platform or media, or even someone's different version, the dashboard is slightly different. So everyone maintaining a sense of humor. And again, sometimes that can be one thing I think people are finding engaging about new virtual platforms is there's a personal aspect that you learn about everybody in their homes, and including our leadership and whatnot. So again, part of that is no different than would be in an in-person workshop, where there would take a certain amount of explanation about how the day was going to run, how we were going to organize the different activities, what the expectations are, and again, then how we do this, and keep things just simple and goal-focused is really the only suggestion.
Okay. Wow, a new platform to learn. I'm barely just learning how to use the GoToWebinar Microsoft Meetings. I'm still learning that one yet. And, you know, it will be interesting to learn some of the new ones. But I think it's all good to try to make it more engaging for employees. It's still very, very critical, especially if this may be for quite some time, for quite a few more months. Okay, Reuben, you're still there. If you can hear me, we have a question that comes in. If a company finds that an employee either tests positive for COVID or has been exposed, what immediate actions should they take, and who's responsible for contact tracing?
Excellent question. So let me separate those into two different things. Those who test positive are considered infected, and we would recommend isolating those individuals. There, from a public health perspective, not saying isolated at work, they should be going home. They're sick, they stay at home. They're considered to be in isolation. Contacts of a case, and that's close contacts, and this is the CDC definition that VDH has adopted. Those who spend 15 minutes or more and have been within 6 feet, so under 6 feet of contact for 15 minutes of time, cumulatively, it's not just in one block. Throughout the day, if it's 15 minutes, that's considered a contact, regardless of if they're wearing a cloth face covering, like I was sporting, okay? So a contact of a case on that day is not a risk to anyone, okay? Because they just got exposed. But likewise, as part of contact tracing, after we talk to a case, we identify those who are contacts, and then recommend close contacts and recommend that they remain in quarantine for 14 days at home, okay? So one of the things that businesses will really need to be doing, we've done this with tuberculosis for years. We do a lot more contact or case investigations and workplace case investigations, contact tracing for TB, even in Arlington. You need to know who's in your building and who's not, because that helps us to, in our investigations, if we're working with a workplace, it helps you as well to know who, if you know someone has, if they tell you they have the test result, and make sure that it's a known test result. Some people may be using it as a way sometimes, unfortunately, to not show up to work. We also don't want to do a large contact tracing. We try to confirm the actual diagnosis before we say someone has been exposed, because it really does affect someone's life. So from the HR perspective, you really need to know who's in your workplace. If you're bringing people together, you need to know who is there. And if you're going to put them in conference rooms, you really need to know even where people were seated, okay? Because I'm going to go back to the question that you asked a little earlier about using technologies. I'm still going to pose the question, why are there people in that conference room, okay? Because there's a tendency for us when we're together to lean over, get closer to each other. And even if you're wearing a face covering, those little minutes add up to 15 minutes, and you could have a exposure if one of those people are positive. So that is why you need to be this intentional in your thinking about what to do. So if you as an employer believe there may be an exposure in your building, that would be the responsibility of the public health department wherever you are. Because so if your business is in Arlington and you've got concerns, you can call us and we can say, all right, what's your evidence for this? If you happen to know someone, we're not going to confirm it because that would be a HIPAA violation. However, we may then try to figure out, and then we may call you back and go, we believe there may have been an exposure in your building. We will not tell you who it is, but we may say they're on this floor. We'd like to know who may have been on this floor, because what we'll do is confirm with the person that was the case, who they may have come in contact with. We may talk to your staff going, who did you come in contact with? Most people know who they've been in 15 minutes of contact. If you do not know who's been in your space within 6 feet for 15 minutes, that's very, very, very unlikely. I hope that helps.
Okay. Can we share the first survey results? I'm just curious. The first question that we asked was, when do you expect to return to the office part-time or full-time? I'll give everyone 5 seconds to respond, please. Okay, can we close the poll? Okay, already returned later in 2020, first half of 20. Okay, so most people are currently, of course, this situations may change depending on the health environment. Most is saying that will return later in the fall, but 19, almost 20% is already back in the office. I am actually not surprised by that. I think considering the amount of federal buildings and people who work for the federal government or contractors in the Washington area, and a lot of, some of them, their work, they're essential, and their work, their position does not allow them to work from home. They may have to be in the SCIF space, so that's why that could be the reason why almost 20% is actually already back in the office. Any comments on that or thoughts on the poll?
I'm surprised it was so much already and not looking further out. Most of the organizations we're working with are, quite frankly, in no rush, and have quite a rigor to, even if someone is deemed essential, a rigor to documenting in advance and getting approval for that person to go in, and then continuously for every visit to the office, the same type of documentation. Likewise, there's whole sites that don't have any essential staff needing to be there, or that are essentially closed. The other consideration is it doesn't just start and stop at your front door. If you did own or be a full tenant in a particular building, we're giving consideration to the context of every location, because you're coming in contact on your way to work, however you commute. Whether you drive or take mass transit or park your car and walk a few blocks or stopped at the coffee shop or went out to the deli at lunch, all of these are just broadening exposure. So really it's consideration to really, for now, staying with as much remote work as possible.
And for those 20%, let's say they're already in the office, this question is about tenant and landlord relationship. If somebody's listening right now who's a facilities or HR person, should they, and their task in transitioning, whether it's in the fall or early next year, what should they be asking their property management companies right now? Emily, maybe you can touch on that. Should they inquire about like the HVAC system, the air filtration system? That's kind of out of their control because they're just a tenant. They lease the building, they lease the office space. What should they be asking the property management or the building owner?
Absolutely. So there's a number of things, and it's interesting as we've just learned more week by week and month by month. There's just as tenants are on different points in their timeline, landlords are as well. There's a lot of landlords who have done a lot of early research and have been vocal in the changes that they plan to or have already implemented. There's been others who have just been also kind of drinking from the fire hose, trying to understand all of the guidance that's out there, trying to understand from an economic perspective what that means to charging back to tenants, what that means for their own costs that they'll take on. So not every landlord has defined an absolute position on the changes that they'll make around reentry. I think the questions to be asking, and part of these are in the resources we'll provide afterwards. CBRE has provided a landlord checklist that can just be used as an initial tool for the types of topics you might talk about. And they range from things on the engineering side, HVAC and plumbing, understanding humidity levels, understanding filters, understanding if water has been flushed, if the building's been sitting vacant. There's a lot of kind of tactical things. There's also an understanding that needs to occur around the operations of the building generally, the cleaning, the signage. Again, that enforcement, it's nice if maybe there's 2 circles in an elevator that say stand here, but is the expectation that someone's actually going to monitor that? Or who's to say, what happens when you get in and you're only one person and 6 more people come in and just say, well, it's fine, I just will hold my breath, not saying that that will occur, but if it did, do you want someone there to monitor that? So again, every building will be different, but it's been my experience that actually a lot of tenants we're working with are holding back on re-entering because in fact their building is not quite ready. They haven't quite solved for all of the things that the tenant hopes they would solve for. And there is, I think, concern in especially some high rises that elevator wait times and things of that nature will just be detrimental to the loss of productivity in a day. And it might not be worth the risk of going into the office if you're also going to lose that time. So again, we'll have that resource at the end that you could look at a more broad checklist, but those are some of the high topic things.
And do you recommend employees or companies conduct a survey to their employees first before implementing any of this type of transition efforts?
Yes, I think Lisa and I both would nod all day to that. Survey their people, do it multiple times, sentiment changes, people learn new things. I think more than ever right now, we've seen the percentage responses to surveys around returning to the workplace are hitting 80, 90% participation, where surveys pre-COVID about workplace environments, we would have been happy with 50%, 60%. People are very eager to give their opinion and to feel that their company wants to know their expectations and details about the return to work. Or return to the office, rather. We know we're all working.
Right, that's right. Let's conduct launch the next survey. It is a question about what type of, this one, I'll give everyone 10 seconds. Okay, can we see the results? Health check, sanitary enhancement, workplaces. Okay. Okay. So Reuben, you see that 9% of the respondents saying that their office is conducting some type of health check every day. I guess it could be temperature screening, things like that. Would you recommend that every day for employees coming in?
Yes. Great question. The purpose of any sort of health screening is really to remind people if they've got symptoms, they shouldn't be coming to work. Okay, remember from that sort of context. So the first thing that employers and residents of communities should do is, if you're sick, stay at home. Even if it's not COVID, this is not the time to spread other illnesses to folks, okay? If you have flu, for example, which could occur this year with COVID, you could have flu. You don't want to bring flu to your office and decimate people from that perspective. So that's the first context. Obviously, creating a culture where you ask those sorts of questions would be a way to help hold people more accountable, saying, look, we're really hopefully asking you in a self-check manner, which we've been doing in public health here for those who do show up to work because of critical functions, to say, all right, do you have symptoms? Do you have fever? Those sorts of things. It's a reminder that we have a responsibility to ourselves. If you're sick, stay home because that's the way you get better. But you have a responsibility to everyone else in your staff, in your workplace. And so those are going to be some of the things you have to think about. What will your HR policies allow and so on in this sort of setting? It's something you have to actively think about. And it shouldn't just be a checklist activity. Please have those heart-to-heart discussions with your employees about why this matters to you as an organization. As I've gone to, if employees are the #1 asset, you don't want people to get sick because others have exposed them.
We have a question coming in. Any updates on like the virus duration? It stays on contact surface. The person saying thinking of conference rooms with tables that are shared.
Sure. It can survive, on what we know, it can survive up to 4 hours on certain surfaces, up to 24 hours on cardboard, and up to 2 to 3 days on plastic and stainless steel. So more than anything else, remember, I know people are afraid that every surface can be a problem, but your hands are really the biggest source of the problem, okay? So it doesn't mean that businesses shouldn't clean, but what you do with your hands is more than 50%, because if you touch a surface that happens to have a germ, if I just do this, okay, it's not likely to infect. The reason why we talk about hand washing and it leading and germs passing germs to the body, if you touch your eyes, your nose, or your mouth, which I'm once again using my hands and you can't see, but trust me, I'm not touching them. But if you touch those surfaces with unwashed hands, that's the way the germs get into your body, by touching surfaces. Obviously, breathing is what leads to people getting exposed more. But if you've just touched a surface with the COVID germs and you keep bringing your hand to your eyes, nose, or mouth and actually touch them, that's adding more germs for the possibility for entry into your body and becoming ill. So businesses need to clean and provide the materials to do reasonable cleaning, but you would need literally to say, look, please clean every single second of the day to prevent me from having that exposure. And you're not doing that at home, and yet you're still bringing germs in there as well. So reasonable things. Obviously, if you can, please wash your hands. Make sure employers have enough soap. Let people have the time to go use the bathroom. Hand sanitizer is only appropriate when there's really no way for you to get to a sink. The thing you also need to remember is hand sanitizer, if you use it well, just leaves dead virus on your hands. It doesn't actually remove it from your hands. So if one of those is not quite dead, soap and water, that's what actually gets it off of your hands. So that's why we really emphasize soap and water. So I hope that helps in that context. It's a business, it's important for the business, and there's a lot of personal responsibility on the point of the employees, and remind people to wash their hands. We need to get to the point where that's socially acceptable to say, oh, I'm sure you just forgot to wash your hands if they're about to use the bathroom.
Okay, you're right. It's personal responsibility. It's up to all of us. And you mentioned all these hand sanitizer cleaning supplies, because in many ways, I think if I'm returning to the office, I will try to remember to wash my hands and not touch the face. But I also want to make sure that the offices are being cleaned, because I just don't know who was the last person sitting at that conference room. And there's such a wide range of the post-pandemic shopping list of cleaning supplies. It has the cheap ones from hand sanitizers to plexiglass partitions to the more of the high cost ones, probably more highly effective, like the titanium dioxide spray or ultraviolet light. If a company has to prioritize and invest in some of these cleaning supplies, what would be the most cost-effective method? Any advice on that?
Sure. I mean, really, for cleaning, okay, because we have to say cleaning and disinfecting is going to be cleaning and disinfecting of surfaces, the ones that people are going to touch. So I think, the CDC has recommendations on cleaning and disinfecting, and then you go to the EPA. If you're not sure, the EPA lists which products are effective against coronaviruses, okay? Because this is a coronavirus, and so if it doesn't kill coronaviruses, you don't want to use that cleaning or disinfecting product, okay? So keep that in mind. you want to clean and disinfect frequently touched surfaces. So that would be things like elevator knobs that are shared and door handles. I'm not saying don't clean the plexiglass partition, but I'm also going to hope that most people aren't touching the plexiglass partition. So remember, some of it's our own actions. I mean, once it's on a surface, it's not going to necessarily leap out at folks. And if it's on your side, if you're the employee and you're on your side, it's your germs mostly. You should be wearing a face covering on that side anyway. So keep those things in mind. So if you have to prioritize, I would first make sure during the day it's the frequently touched surfaces that everyone shares. Elevator buttons, doorknobs, door handles. If you can in your workspace, can you leave your doors open? You may not be able to do that for the initial fob entry, but if everything else is secure, we've now kept conference rooms doors open. If for the few people that we've had when we had our command staff here and so on to run incident command for COVID, but that's the type of thing that you need to start really looking at your practices and saying, can we do things differently? I now hold, if there's someone following me, I hold the door because there's no purpose in my touching it and that person touching it. So we have to think about how we handle our surfaces differently.
Okay. We have a question. It says that should we keep the office kitchen closed since it's a high traffic area?
So what we've recommended is, I mean, obviously, unless you're requiring everyone to bring in food and it never needs to be heated and so on, I think once again, you're going to have to decide what is going to make your employees able to work in that setting. Once again, I'm still going to ask, you better have a pretty darn essential need for them to come together. So we do have a few people here. We use the microwave and so on, but we hope not to dine in the kitchen. And we ask people to keep 6-foot distances, wear face coverings when they're in there so they can get their activities of daily living done. So if you really need to be there, then do these things. If you don't, then you'll have empty kitchens.
And I think this is where also workplace strategists who have for so long harped on building community, and they've said, you know, let's enforce policies that say don't eat at your desk, you need to take a break, you need to socialize. We have to blend kind of art and science here to say, you know, maybe in a year from now, we'll go back to that policy and encourage people to eat only in the cafe and not in their neighborhood or workspace area. But today and right now, these policies do need to adjust. And that's where that critical communication piece is necessary so that people don't go back to old habits and quite honestly make just a mistake and say, let's eat lunch together, not realizing that you can't do that right now. So you have to be flexible to make those policy changes.
I think to Emily's point, I know a number of people at home are doing Zoom happy hours. There's technically no reason, if you organize it well, you know, you don't want to disturb your neighbor, but if you really want to eat together, can't you eat together from your computers and in front of them? If we can do Zoom happy hours at home, there's technically no reason we can't dine together safely on screens.
Anyone wants to share your favorite incidents or working from home using Zoom or Microsoft meetings or innovative ways of communicating with each other, with your colleagues?
I have a quick one that I can share. Sorry, Lisa. We, about a month into everything, we had our culture committee for our team of about 45 people in the US who, by the way, we worked distributed pre-COVID. So we had offices in Atlanta, Chicago, New York. So we were accustomed to this kind of environment, but we were also accustomed to having a few of us in the office together. We did a scavenger hunt on a Friday afternoon for one of our team calls, and it was really fun. You know, it was, okay, you've got 20 seconds, go pull yourself these 3 items from your pantry and come back and kind of show them on screen. And we gave people points and we had kind of some fun with it. And then we also did some brain teasers where, you know, really quick, you'd have to solve a math problem that was something that probably a 4th grader could have solved faster than the rest of us. But it was the kind of thing you could laugh about, and it was a little bit different than just the kind of Zoom happy hour that I think really hit a big craze early on. So that was a fun thing that we did.
Mm-hmm. How about that?
Along the same line, the way you would sometimes when you have a new project kicking off or something, have a team building session, usually in person, but now virtually. We've done the same type of exercises where you, for example, have 4 items that people might not know about you to share. And one of those items that you put forth is not really you. And people have to guess which one. So there's some practices that are good techniques for team building and getting to know people that actually can be done quite successfully this way. And just with our own internal Jacobs team, we're encouraging outreach in different scale groups, because as Emily noted earlier, it is many of the younger staff are quite concerned about mentoring. That can be done very successfully virtually because it's quite private. So one-on-one, calling someone through Teams or chat or whatever your format is, that actually to have one-on-one, it can be very brief. There may have to be a little bit more of a scheduled cadence to those sorts of things rather than ad hoc in the office. But in this way, sometimes where people might not have gotten the attention unless they in the office asked for the attention, are actually doing potentially better. So we're trying to, particularly in Jacobs, we're trying to actually really look at talent. We've won as an organization, they feel strongly the work and the demand is here, and it will be there when things are back fully up and running, probably next year. So we want to make sure, how do we not only attract talent, but retain talent? And we all know that in any organization, you can do that through culture, and there's sort of the macro culture, but really the micro cultures are why people stay. That's how you retain. And those micro cultures are those relationships that you build with your teams and with people in your particular office or within a particular subject matter of expertise. We're working like that in a distributed model globally for resources. So again, it might need to be more mindful cadence, but it can be done. And oftentimes it's actually enhancing what was there before.
Mm-hmm. And I think, you know, we've been working, the stay-at-home order started for us on March 13th. And I find that we're still quite productive. Everybody, you know, I think we've all worked through the kinks in the beginning now with teleworking, but I think now we're all getting into the rhythm and doing the best we can. I would presume it's the same for most people here on this call, who not be cited.
We have, and we measure that in different ways through survey. Again, we are, I know on our prep call, Dr. Varghese said, you know, we don't want to be date driven, we want to be data driven. And I love that because we're data driven about everything we do, because we're about aligning a value proposition with evidence about what potential solutions may bring and how they bring value to an organization. So again, you can use survey to not only poll employee engagement and satisfaction, you can use survey tools, and by changing the questions, you can, you know, understand what percentage of time people spend in different activities. And not that we weren't doing that before, but now you just maybe need to add a layer of preferred, whether that could be virtual, better in person, or site essential. So we're using, you know, digitization in different ways, and even accelerating some of the enhancement of that and investment in that for our own strategy tools. But there's ways to get the same information by just thinking differently about, often using quite common, just how are we communicating with one another? And it's not that we needed a really huge change in technology to have a platform like this. We were doing this before. It's just what we're using it for and for what benefit.
Mm-hmm. Okay. You know, about the social distancing guidelines. I actually really like, I've heard there's this app, you can put it on your phone and it will, you know, ring if somebody is within 6 feet of your perimeter. You can put that on your app. I thought that is a very smart device to have.
Now that's clever, and I would equate that to the sensors on, you know, many cars now. Have a beep go off when you know, in your blind spot if someone's too close. And there's many times where, again, there's bottlenecks in how we commute and how we circulate vertically through space in stairwells and elevators and whatnot. And there'll be times when that type of sensor will just be going crazy, because many times there's corridors that are 5 feet wide. So again, we're trying to be, you know, considerate of things like context, distance, and time. As Dr. Varghese mentioned, you know, that 15 minutes is cumulative, but if you're passing someone in the hallway, you're not going to be able to go one way for everything in every context. There's many things that we're not going to be able to control. To Emily's point earlier, you might set a protocol, but then the behaviors are something else. So again, much to consider before actually pushing people back to the office.
Okay, we are coming up on the hour. Let me just check if we have any more questions. I think we've responded to most of the questions. Any closing thoughts, Emily?
Well, I just hope that this was helpful for everyone today. I hope that they are still taking this time to learn and become educated about all of the great resources that are out there. There's certainly no shortage of reading materials available, whether they're opinion pieces or playbooks or checklists. And I hope that there is a nod towards really understanding the essential nature of returning to work in the physical office versus virtual. And I wish you all good luck with that.
And CBRE has a very nice, the playbook, the Reopening the World's Workplaces playbook, a very comprehensive checklist. It's really a step-by-step guide to help decision making. And it will be available on our website. You can download it. And it's on the last, our resource slide. And Lisa, closing thoughts?
Thank you. Again, thank you for the opportunity to share thoughts and insights. And again, in that, sort of, we've put as a resource for people to use just for discussion and how your teams might be working is the activity value matrix. And it's a thought piece on that and an article on that, because again, how you previously did something doesn't mean that that's how you need to do something now. What's the most effective and efficient way to accomplish what you're trying to accomplish from a business purpose alignment? And that's what we would encourage.
Okay. And Dr. Varghese.
Okay, well, thank you. First of all, thank you for my panelists and to, fellow panelists and AED for putting this together. I hope it's been useful for all of the folks who've been listening. I'm going to be a broken record. Stay at home if at all possible in telework. If it's not, I hope it's for essential work. And then for that, maintain 6 foot distances, wear face coverings when 6 foot distances are not possible, and keep that under 15 minutes. Provide for cleaning and disinfection per CDC recommendations, and emphasize personal hygiene habits or personal habits at the office and at home. And this is an opportunity to be creative in some ways, or novel. Novel coronavirus is new, but that novel is also, maybe we need to start doing our business practices differently to be ready for the next era, because germs are here to stay and we will get over this pandemic, but Mother Nature has a way of always coming back. So this is not going to be a one-time thing. So start thinking about how to maybe do things differently and incorporate this sort of telework and as well as in the office sort of hybrid model that may be one day coming. Thank you.
Yeah, thank you very much. I think this is great advice, and we should all wash our hands regularly. Thank you very much for joining us, and I want to especially thank our 3 panelists. I think this has been a wonderful discussion. You can download it on it will be loaded on our website. Thank you, and have a good day.
Thank you all. Be
Bye.
well.